Hookworms. Hookworms are intestinal, blood-feeding, parasitic roundworms that cause type of infection known as helminthiasis. Two main species of roundworm belonging to the genera Ankylostoma and Necator.
The worm is pinkish white. Adult male hookworms range in size from 8 to 11 mm long, whereas adult females range in size from 10 to 13 mm long. This species is dimorphic, with the males having bursal characteristic and needle-like spicules with small tips which are distally fused.
The survival adaptation of hookworms. The eggs of the hookworm have developed a thin shell that serves as protection. These shells allow them to not be harmed as they travel through and out of the digestive tract. The hookworm larvae have an amphis that allow them to locate their host while living in the substrate. These detect the host and allow the hookworms to find, attach, and penetrate the host, in this case, human. The juvenile and adult forms also have adaptation to help them survive. They have developed two pairs of sharp teeth to allow them to attach to the intestine of their host and eat the intestinal mucus. These teeth also allow them to penetrate blood vessels so they can feast on the blood.
Economic importance. According to the researchers, this study shows how the cumulative economic impact of a subrogate chronic disease like hookworm can eventually exceed the impact of disease that have higher mortality and more salient health effects. Quantifying the economic impacts of hookworm infection could help organizations make informed investment in intervention and control measures. Policymakers, funders, and companies often use cost and financial measures to determine where to invest and allocate their resources and efforts. Such investment, say the authors, can not only improve the health of those with hookworm, but support the economic growth of affected regions as they become more economically productive.
Uses and symptoms of hookworms. Individual who suffers from severe allergy infects themselves with hookworms, their allergy seems to go away. How? Firstly, hookworm attach to the human intestinal wall, then the immune system begins to attack the parasite, so it develops a response using some unknown chemical that suppresses the immune system. Allergy caused by an overactive immune system, so suppressing the immune system alleviates allergies. For symptoms, how to know infection of hookworm. There are some symptoms such as abdominal pain, intestinal cramps, nausea, blood in stool, loss of appetite, itchy rashes, colic or cramping, and excessive crying for infants.
Lower your risk of becoming infected with hookworm by wearing shoes when you walk outdoors, especially in areas that might have feces in the soil. Drinking safe water, properly cleaning and cooking food, practicing proper hand washing. Developing nation practice previous treatment. This involves treatment group of people who are the higher risk of having infection. These include young children, women in childbearing age, pregnant women, women who are lactating, adults who work in occupations that put them at risk for heavy infection.